Wissen Sie, das Gehirn produziert TSH und letztendlich die Schilddrüsen T4.
Haben Sie irgendwelche Schwerschwierigkeiten?
Nein.
So as a doctor, you definitely need the passion, and going on tirelessly, you need passion for it. But in the end of the day, I'm happy to be a doctor because I feel that I am contributing to society, and it's always these little moments where I feel that I can give some support and help to patients that keeps me going.
We didn't assume that. sorry. I'm going on the outside. Osler is based on a doctor called William Osler. He's actually a pioneering Canadian physician. And in his days, he not only was talking about medicine from a scientific sort of angle and how you treat something, but he really looked at a patient holistically. So one of the things he said was to actually, listen to your patient, listen to what they're saying, spending time with them. That embodies our Osler culture, where we want to listen to a patient, not only treat them and treat their disease, but actually treating them as a whole. So William Osler is a giant in the medical field, and that's the reason for us adopting his name.
Pretty stable.
The main aim of medicine is to help, and whether you're helping physically, like in treating a physical disease, or just there to comfort and support mentally as well. And that's why as a general practitioner, as a family doctor, it's important to have all these perspectives in place, that very often it's not just a physical condition, but there's an underlying mental aspect to it that's hugely important, and having that relationship allows you to explore all the perspectives and cover all ground.
I guess as I got through school, I decided that I wanted to do something that was meaningful and involved helping people. I think if you spend a lot of time with different people every day, listening to their problems, their worries, what makes them happy, what makes them sad, I guess you develop more empathy and understanding for other people, and that probably changes who you are as a person, and probably how other people perceive you as well. It's one thing to have knowledge and the solution, but it's another thing to be able to listen and actually care about the person and what they're going through. I think that's what we all try to achieve each day.
Donc pour la France, dans 2-3 mois, ça sera Pfizer. C'était Pfizer.
J'ai reçu les 2 doses à 5 heures.
Yes, it could be about how we can make ourselves happy, but it's more about how to make other people happy.
And I think being brought up, my background Vietnamese and being brought up in France, so my mom always told me that your appearance, your behavior will cheer someone who sees you, even in the street. If you're happy and you say hello, it helps that person and it gives them a better day. I like to see my patient when they leave my consulting room with a smile on their face. And I think it's important to know that we doctors, we are all approachable, we're here to support you.
I think I feel very privileged with Osler Health that we can actually really offer that. We really look after them. It's the core of what we do. And we can actually do it. I think a lot of people, when they're practicing, have constraints within the system they're in, whether they don't have time, whether the system doesn't allow them to do that. Whereas here, we've managed to have a system where, patients are really taken care of from the moment they ring up for an appointment. We always say we look after patients from the heart and from the core, and I think our team really understand that and really deliver from the heart.